I'll just say hello to everyone and welcome to the second Livestrong Solution Series. My name is Victoria Threadgold and I'm the Director of Grants Management at Livestrong, and we're grateful that you could all join. To kick off this webinar, we'd like you to answer just a couple of questions to get started. So all the attendees can see these questions on screen, hopefully. There's just two. One is asking about technology in your programming and during the pandemic compared to before the pandemic, before COVID-19 hit. So whether you're using it more or about the same or less than before. And then the second question is about the biggest challenges surrounding technology you're all facing in your organization and the programs that you're doing. So if you could just select one of the biggest challenges there. We've just given you some examples. Scroll down, there's a couple you can see. We'll give everyone a minute and then Brittany can post the results online when everyone has had a chance to make their selections.
While you guys are voting, I'm going to say good morning, afternoon, depending on where you're joining us from. And I just ate lunch, so I'm going to say it's afternoon, even though it's only 11 where I am today. So thank you all for joining us. For those of you who can't see me, maybe I'm Suzanne Stone. I have the honor of being the Chief Strategic Solutions and Programs Officer here at Livestrong. Really excited to have you join us today for a discussion that I'm pretty jazzed to hear what you guys are doing. Talk about timely. We just at Livestrong, we just had a board meeting last week, and this is a quarterly event for us. So we were kind of bringing everybody up to speed, and I was talking about all the grant applicants, many of you being those grant applicants, whether you got the award or not. Part of the, so excited to have you, this is part of our family now. But I was talking about how when we opened the applications, this was really before COVID had really kicked off. And then the LOIs all come in, and for those who had to finish the second round of applications, some of those projects and programs shifted significantly because of COVID. And so everything that we're funding right now has the technology aspect to it. We have heard over and over again some of the challenges around it. We're really excited to hear from you today, not just about what the challenges are, but specifically around solving them, to be really creative about them. And the panelists who are working with you today have already had some discussion around that. I'm excited for them to kind of lead the solution. So I encourage everybody to put on your big what if hat and think, well, what if? What if we had the, what if SpaceX could launch a big satellite array that connected everybody magically, through their television antenna, whatever it is. Think of those big what ifs and see if you can find solutions. So thanks again for being here. I'm going to go on mute and leave it to you, because one of the things I love about Livestrong is we are committed to listening and hearing, and the things that you share with us are the things we're going to be focused on. So get to it. I can't wait to hear your solutions. And thanks again for spending an hour with us today.
Thank you, Suzanne. So I think if everyone's had a chance to do the couple of questions in the poll, if Brittany can close that poll and hopefully post the results and make them available just to see where we're all at today.
I'm waiting on one more person. Looks like 10 out of 11 people have responded. So I'll give that person like 30 more seconds.
Okay. All right. We'll see who's going to respond. But as Suzanne said, when we launched the Solution Grants program at the start of the year, we couldn't have predicted this pandemic, how everyone is pivoting and changing on that global scale. And I know that we were so amazed at the responses we had. So 231 applicants for the initial round. We had to narrow it down to 25 finalists, and then the 8 grant partners that we announced last month. So here, 100% are using technology more than before. I think we're all accustomed to Zoom platforms and online communication tools now. And then for the second question, we see that 40% of you all are having some challenges around the technology, certainly with cost and availability of technology hardware, and then 20% coming in at the cost availability of technology software, and then internet access connection quality. And then 10% of you are just concerned about the privacy, security, and then some distractions, interruptions while online. So they were just a few examples. I'm sure there are many more. We can discuss them today as well. But thank you for doing that poll to kick things off. And as I said, like last month, we announced the grant recipients for the solution grants. And while we couldn't fund everyone, it's such an important, I think, part of the whole program is to foster relationships. And that's why we are doing these solution series webinars every month. So today we'll be talking about technology. Before I get into the subject and introduce everyone, just want to go over some housekeeping rules or some guidelines really. So this webinar is being recorded and we will share the recording with everyone in a follow-up email tomorrow. The attendees are all on mute, but the panelists you'll see hopefully on your screen, they're on camera and they have control over the microphones. So I encourage though everyone to use the Q&A feature at the bottom of your screen. There is a Q&A and we'll be monitoring that. And there's also a chat box. So a couple of you have put some things in the chat box. I've just linked the panelist bios in that chat box. If you didn't see the reminder email that got sent out yesterday, we sent around the link to all the panelists. We didn't want to take up too much time today introducing all the panelists, so you'll have them as a reference point online, just knowing where they're coming from and what they're doing. But please use the chat box to share resources and suggestions as we go through the conversation today. And then just very briefly, I will say we have the people on the screen. We've got Len from HopeCam, we've got Jordan from Wonders and Worries, Michelle from the University of Michigan, Andrea from Family Reach, and Anne from the Showers Family Center for Childhood Cancer and Blood Disorders at the Akron Children's Hospital. So I would like to jump into the discussion today, which will be centered on access. So technology access, specifically focusing on the hardware, software access challenges and issues. And then we can talk also about internet access, so connectivity, bandwidth, security. So I'm opening up to the panel and just asking who would like to start talking, maybe about some immediate hardware and software access challenges and issues, and any solutions that you've put in place sort of immediately to mitigate these problems. Would anyone like to unmute themselves, or shall I? Oh, there's Jordan. Thank you, Jordan.
I can start. So at Wonders and Worries, we actually already had some virtual things in place, and we were moving towards becoming more virtual. So it just kind of worked out that we already had some systems already. We use Ring Central. That's what we've always used for phone calls with families. It's confidential and a safe way to interact with families with therapeutic support services. So we already had that set up, and then we just were able to send a link for Ring Central for families to access. So that was a safe way to start video chats. We did have issues with internet access. Luckily, the Austin ISD, they started using buses too with hotspots. So the school systems were kind of helping with those areas that maybe didn't have as much internet access. But and then technology-wise, sometimes our staff, their laptop camera was broken, so they sometimes would use their cell phone instead. And if families just weren't able to get access to video chat or didn't have the device, they usually would have a phone, and we could just call the family and coach them through our sessions. And so our program is a 6-course session for supporting kids who have a parent with a serious illness. And we have been mailing the supplies for the therapeutic activities for each session. So they'll get all the supplies to their door. And what we would do if they couldn't do a video chat is, or if they were too young, if the kids were under 5 years old, we would just go ahead and coach the parents anyways and kind of give them an idea of how to facilitate that activity, what sort of questions to ask, just so they feel a little more confident in how to help give their kids that same session the best way possible without access to video chat. And then we would have a discussion with the parent afterwards, just decompressing and what came up, what sort of questions were asked, and we're just constantly communicating with the parent. And ultimately, that's the best relationship and the communication to build. We want to empower the families to be able to navigate a parental illness on their own. So that kind of put the parent in a role to kind of start building that communication with their child, so that they feel comfortable opening up and talking about things and their feelings and the questions they have about their diagnosis. So yes, if internet access was not feasible at all, we resorted to the phone and just coach the parent.
Great, thank you for that. And Livestrong also uses Ring Central. I've just put that link into the chat box. It's an online communication tool. The Ring Central meeting is very much like this, set up with Zoom. I think it's powered by Zoom, but the Ring Central also comes through to our phones. So we're not then having to rely on our landline phones in the office. It's all coming through our cell phones. Thank you for that. Len, did you want to talk as well? I know that you unmuted yourself. Did you want to talk about HopeCam, what you're doing? And
there we go. Yeah, no, so HopeCam, we started the video chat experience in 2002, back when there was no Skype or Zoom or NetMeeting. We used a software called NetMeeting from Microsoft. So we've gone through lots of different versions of different software programs that we've used. The one that we've been using for the last year and a half has been Zoom. But we had a bit of a problem because we connect kids with cancer to their classmates. And when Zoom had that security breach a couple months ago, a lot of schools abandoned Zoom and went to different platforms. So our team exclusively was using Zoom. So we had to really pivot quickly and learn how to use Blackboard and Teams and some of the other software programs based on what the schools were dictating. But the other problem that we've had, I would say about 70% of the kids that we connect, we pay for their internet, and we provide it to them through a MiFi device, a hotspot device. And one of the biggest problems we're having right now is there's just a global shortage of those devices right now. So it's really hard to get one. So we've got a lot of kids that are coming through in the intake, and we got them queued up and waitlisted until we can get them an actual modem MiFi device. So that's one of the clogs. So challenge, was now I think more schools now are coming back to Zoom now that they've instituted some of the security elements. But the other challenge too is that a lot of times the teachers really don't understand how to make these connections. Well, I can tell you right now, they're all getting really smart about it. And so in terms of actually connecting these kids with cancer, they all have the muscle memory now on how to do it because they've practiced. And I think everybody that has access to a computer and a camera is figuring out Zoom. Even my 85-year-old mother now knows how to use Zoom on her smartphone. So the good news is that more and more people are using it, becoming familiar with it, and I think that's going to drive a lot more engagement for our kids.
great, thank you. Does Michelle, or Andrea, Anne, do you have any comments about sort of the challenges you're facing in terms of internet access regarding any hardware or software?
So our project is a little bit different in that it is involved some online surveys about patients' quality of life used to drive their in-person visits and what those consist of in their survivorship visits, and also to make sure we cover all of the bases, because quite frequently if you ask a patient how they're doing, they'll say fine, and you won't get a ton more information unless you ask every single question in ways that we can help them. So our issues and I'm dealing exclusively with adults have been more on the upper age spectrum, end of the spectrum, in technology being able to use challenges, and then also patients having hardware, Wi-Fi, or access to smartphone issues on their end. Our solutions to those issues have gone lower tech when we need to, and just calling patients and going through that. I was excited last week when we were talking a little bit about among this panel about and maybe reaching out to some of you about the potential for patients socioeconomically in need, about the ability to get help with things like hotspots or hardware on their end. We are also a little bit more restricted in what types of platforms we have been able to use. So on one hand, have been pretty lucky that pre-COVID, the University of Michigan had been moving in a telemedicine direction and had been using a Haiku through a platform called Haiku through our actual medical charts that we've been able to access to some degree. And with the caveat that when 2,000 providers at the institution all want to get on a video chat with patients at the same time, everything tends to jam up. But we've been able to use those platforms, and then also over the phone and in video platforms, we've used Doximity, which has been approved through our security networks.
Great, that sounds great. Thank you. Anne, did you want to comment?
I do, thank you. So, it's been interesting for us as well. I work with patients, pediatric and adolescent and young adult, and trying to have them stay connected, switching them to all virtual visits. The hospital went in overdrive to kind of get that up and running for patients and families. But when you're actively on therapy, a virtual visit is not feasible. So trying to find ways to creatively use our online resources and to be able to keep them connected. The other part of that too is that with all the restrictions, the number of people at the bedside changed, and patients and families weren't allowed to have more than one caregiver with them, which posed some problems too. So we were able to creatively use some platforms to be able to communicate with patients and families at home. I think that, again, Zoom was initially, if we were just having a kind of conversation, social conversation with a parent that couldn't be there, but with security issues and patient confidentiality, our Haiku system through Epic was overwhelmed as well when we tried to get all people on it and using it. So trying to have access to those tools and have them work efficiently was definitely a problem at first. I think we've begun to work out some of those kinks, but again, I think another huge problem with our population is the ability to, just because they have a smartphone or they have a computer doesn't mean they necessarily have internet access. And so that we've had to creatively find ways to get access for people. We serve patients throughout the state of Ohio, and some are in pretty rural areas and some are in pretty urban areas that don't necessarily have the access that is needed as well. So even if we've been able to successfully communicate and treat with them through some sort of electronic means doesn't mean that they were able to facilitate on their side as well. So we continue to struggle with trying to make sure that everyone has access. I think it's the same thing with a lot of the schools that they've been dealing with. And just because the kids were at home doesn't mean that they could be connected to their classroom through all these media outlets too. So I think the nation as a whole is looking at ways to make it more accessible to everyone. And we definitely struggled with that. I am grateful for things like the Haiku system, but again, I don't think anyone was prepared for the sheer number of people and patients that would be using it all at once so quickly. It's definitely caused some problems in trying to find secure and HIPAA compliant ways to deal with patients and families with very sensitive topics to discuss.
Great, thank you. And Anne, if you could maybe just pop a link about the Haiku system in the chat box if you have it, or some information, or we can share it out later because that might be useful for others to explore. But Andrea, did you want to go and talk about Family Reach and just, I know that sort of how you're continue to serve your clients, like with technology or phone calls and things?
Yeah, so we have a little bit of a different model. We've been more virtual prior to COVID because we partner with over 400 hospitals across the United States to provide support to families affected by cancer, whether that's through resources, financial planning, or financial assistance. So we've always kind of had a virtual model, but we found that for families who did not have internet access, what could we do? So we also allow for families to inquire about our services by the phone, and we'll fill out the application form for them. And for those that do not have phone or internet, but are also seeing a healthcare provider, the healthcare provider can also fill out the application form. Now, come COVID, if you're not going into your appointments and you don't have internet or phone, we face the same challenges as the rest of you in that they will not have access to getting our services. So we're hoping that a phone or internet is somehow available during these times. But for us, having that three-tiered approach of internet, phone, or assistance from their healthcare team has been really helpful for us so far. So it's a little bit different than the rest of you, but we can also share the similar situations and challenges for families that don't have access.
Great, thank you. And Kate put in the chat box, she was saying about sort of low-income families, and was wondering whether anyone has dealt with overcoming barriers to lack of in-home equipment. So, you know, phone, computers, medical monitoring tools, due to being either in a rural area or just the low economic circumstances of some patients and clients.
I can answer that one. 70% of the kids that we connect are Title I schools, so they're in subsidized meals and so forth. Roughly half the kids that we connect are from St. Jude. We've connected over 2,000 children since we started, and so yeah, it's a real challenge. So you have to have the ability to kind of mix and match based on what their wireless connectivity. Sometimes we have to use a Verizon product or a T-Mobile product or an AT&T product, depending upon where they live. But for the most part, we've been able to, connect the majority of the children that live in rural areas. But that's where the digital divide is really the greatest right now, and where so many families are being left behind. I mean, we started HopeCam with the sole intent of just making kids feel less lonely. And our biggest problem, believe it or not, has been convincing the families to do it. And also the gatekeepers are the social workers at the hospitals. So now one of the things that we're able to offer the social workers as an incentive is that, this is a telemedicine device. Effectively we give kids either a laptop computer or a tablet computer, all of which can download the app. So we're now seeing a little bit of an uptick now as more and more hospitals and other medical partners are seeing the dual benefit from both the social element as well as the telemedicine element, which I think is just a huge breakthrough. You really have to give the FDA and all the people in the federal government the props for opening up that gate, because that was a very high hurdle to get over for telemedicine with the risks associated with doctors and practitioners, to be able to use it. But now, we're seeing just a significant increase in the number of kids that we can connect because there's a strong incentive there. But with the digital divide piece in the rural areas is the hardest part for us.
Great, thank you. And then Erica's asked a question in the Q&A asking whether anyone's navigated virtual visits with pediatric patients in a hospital setting. They've come into some HIPAA concerns from the hospitals. And I know, Anne or Michelle, sort of from your experience, well, not Michelle for children, but Anne, from your children's hospital perspective.
Yeah, I think that it becomes tricky because you have to have a parent involved, and so you have to have parental consent, and then a parent has to initiate the call and initiate the interaction, and then invite the child in. And so our hospital has worked with our legal department to set kind of some guidelines on what that looks like. But there is a lot of our well care visits that our pediatricians in our hospital are doing virtually at this time are done with parental consent and the mechanism of which the parent is present throughout the visit, parent or guardian. I think some of these other resources like Ring Central have some of that ability as well too, from our previous discussions with the panel, that some of them have HIPAA and other things in place to make sure that there's the patient safety is protected as well. I think it's tricky when you're at that adolescent age, where assent is allowed and that teenagers can have more autonomy to be able to show up for visits on their own. I think that that's an area that we will more clearly define as this whole crisis and virtual medicine evolves. So I think it will be interesting to see how assent will fall into this and allow us to be able to have those confidential visits with those patients who need it at that age.
Great, thank you. And Michelle, I know that you don't deal directly with children, but in terms of the patients that you're working with your pilot program and sort of the electronic component of those surveys and managing that health data, do you have any comments about what you're doing and how you're navigating that?
I guess our system was built to be kind of completely in the electronic medical record, and behind the answers or electronic surveys are all kept behind the University of Michigan firewall, and so we haven't had those issues. I guess clinically outside of this project, you know, we're no longer, we've struggled a little bit with consent for medical procedures outside of this project, and have converted largely, I think, across the Cancer Center to virtual consent, so as not to bring patients into clinic specifically to go through consent, but have also tried to be mindful of we've been making sure to do all of that through video chat with you know, while trying to virtually send patients copies of everything that is transpiring, and to be very comprehensive in how we are you know, educating patients about their disease and about the whole process of going through cancer care.
Great, thank you. And I just maybe go back to Jordan with Wonders and Worries. I was thinking with your interactions with children, and again, sort of the consent and sort of, have you had concerns about issues regarding privacy and security when you're doing your online visits and meetings and interactions?
Not so much with the technology piece. Again, Ring Central is confidential, and then we also use Apricot. That's a platform that we do all the charting in. So that's a safe place where all the patient information is kept. And through Apricot, you can send consent forms where parents can electronically sign, and it's all in that system. So that made it really easy for us to get consents virtually. And we incorporated consenting to have their tele services through Ring Central. So they signed that they would that their child could receive support through video chat, and then also that a parent would be in the room. So that was another safety thing, just to be sure that there's an adult somewhere nearby in the room to, you know, kind of set it up and just be there. That was the issue with just the own child's privacy of how much are they willing to share and talk about when their parent is sitting in the room, or when they're all in the same house and siblings are walking in and out of the room and like poking. It just, that kind of affected how much that child may have opened up. So we would again communicate with the parents and talk to them about that aspect of just kind of sensing that they weren't opening up as much, or seeing their eyes shift off screen because someone's walking by, and just encouraging them to tell their other siblings to go play in a different room, or while they're in the room, plug some headphones in, listen to some music or a podcast or read a book, or just where you're physically in the room, but you're not like listening to the entire conversation, just so that child feels like there is a little bit more privacy. And we also had some teens just like type in the chat because they didn't want to like ask the question out loud. So sometimes it would shift and they'd just be chatting and typing because that felt more private when other people were in the room. But yeah, it was mostly that, where they didn't have the private room with our child life specialist. They're at home and there's just way more distractions and everyone's around and can hear. So that was the privacy concern for the most part for us.
Great, thank you. And Len, I'd like to go back to you, because we spoke, was it I think Friday, and you were telling me it was a good story about the historical nature of HopeCan and how you started on, I think it was Skype, and then now you transitioned to Zoom. It kind of covers the platform access issue, but also that security issue with the two-step authentication that you were having problems with your devices. Could you just sort of just tell others, because that was our conversation, but I found that sort of quite useful with Skype, and now everyone's sort of transitioning into Zoom.
Yeah, so yeah, the original connection before Skype or Zoom or any of that stuff existed was called Microsoft Net Meeting. It was tremendously buggy, but eventually we migrated to Skype, and Skype was a partner of ours for years. But then they initiated that two-part authentication where you had to have a cell phone associated with your Skype account. And so what happens is a lot of our families, don't speak English. A lot of our families are not very tech savvy. So before we would ship the tablet computer or the laptop computer, we would preload the software at that time with Skype. And we would create an account for them. So all they had to do, we give them really simple instructions: open it up, turn it on, go to Skype, click it, and it's ready to go. But the problem was, in order to create more security, we had to have a cell phone, and it was just impossible, because we're pushing out 30 of these tablets a month, more. And so we finally we tried working with them, but we finally migrated over to Zoom. And then on top of that, Zoom then doubled down and agreed to give us a treasure trove of data that would help us see how often these children were connecting with their classrooms. So they would give us access to the date and time and length of the conversation, so we could begin to start to collect data on our children and to see how much engagement was being actually created. Because pretty much once we shipped the hardware and the software, and we helped them troubleshoot that very first connection, we checked in with them every month or two, just to see how it's going, if there's any problems, but we never really were going any deeper. And now that Zoom was able to allow us to get an inside view, now it's a tremendous tool for us to see how it's working, and who's using it and how effective it is. And it gives us a lot of great opportunities for follow-up too. Again, I'm hopeful that more of the schools will go back to Zoom. Now we've got to go try to create those same types of relationships with Blackboard and some of the other technologies that are being used at the schools.
Great, thank you. I think, yeah, the two-step authentication and having like a phone with you and passwords, it's great for security and access, but when you don't have that sort of nearby or to hand, then it creates a problem, and that in itself is a barrier. So thanks for sharing that and how you've mitigated that with other technology providers. Just thinking now more of a longer term sort of outlook, and who knows what that's going to be like, but thinking in terms of the future and what you're doing right now, does anyone have any comments about sort of any strategies in place? Have you been discussing this within your organizations about sort of the long-term prospects and outlook of what you're doing now? Is it sort of, this is just sort of a reaction to the pandemic, or is this likely to be put in place, your online technology solutions for the future? Say if the pandemic sort of was over and COVID sort of went away, would you do a hybrid? Would you go back to how you were, say, in February? Or what if COVID continued and the pandemic sort of, you know, lasted longer than anyone wants? So maybe, has anyone got any comments and plans about the future?
I can go. We, like I said initially, had been moving more virtual because we do want to be able to reach more families, and all our services are free. So again, it's a balance. We've been wanting to get to the point of being able to do virtual services like we are right now. So the pandemic kind of prompted a really quick response to get that going. Because of our staffing, we just don't have the bandwidth to expand further out from where we typically would see clients. So we work with families that live in Travis County and any bordering county. So that's where we're sticking to right now. We won't do virtual services currently for anyone like out of state or further outside that area, just because we don't have the staff to be able to facilitate that. But it is something that we've been wanting to do. So that's kind of helped to have this already in place right now. We do have plans we have a teen app. So kids who have a parent with a serious illness have access to a teen app, and that launched last year. And we're looking to create more apps, one for caregivers and one for medical staff as well. Just for support. So that's another way that we can reach out to more families across the country, globally too, even as well. And then we also have a registered Wonders and Worries provider program that we also, our first facilitation of that was in February, where we are, another way to access more families is to train other mental health professionals in our curriculum. That's been researched and evidence-based. So child life specialists or social workers or other licensed mental health professionals can get our training. We did it at our office in Austin in February, but we're looking to make that virtual as well, so that people can get the training wherever they are in the nation, and then they can then facilitate our curriculum in their own private practice or their own hospital. And that's another way to kind of reach out and train others in our program to access more families. What else? We also have a helpline that's national that also launched last year. So we extended the hours for the helpline during the pandemic, and the helpline is, again, anyone can call it. Families can call it, friends of family members, medical staff like nurses or chaplains, social workers. If the kids are coming and they don't really know what to say or how to talk about the parent's illness in a kid-friendly way, they can call the helpline and get some advice and tips. So we've extended those hours as well in response to the pandemic, but we'll just kind of look at those numbers as well, and with funding to see if we can keep expanding those hours as well too.
Great. Oh, thank you. It sounds, yeah, you're thinking about the future, but making the most of technology. I think, yeah, using it to broaden to other areas where you can't kind of reach people in person. While other people are thinking online, I know that Lisa on Vital Hearts, she's on the webinar, and she said that they're planning to do a hybrid model as well. And so obviously all of the applicants who made it to the finalist round in the solution grants had to come up with the challenges. And most people did mention sort of COVID-19 and how they're having to adapt and plan ahead and change. So I think the hybrid is one way, ideally, if we can do in-person events, and then doing a mixture of the electronic communications and meetups as well. Anne, did you want to say something about longer term solutions and plans?
Yeah, so our hospital has developed a school-based health program where we have a nurse practitioner team that will visit children in their school setting to do assessments and evaluations with them. And we have discussed collaborating our survivorship team with the school-based health to either work with the schools to do some virtual visits because we know that it's easier for them to have access at school than necessarily at home if they don't have it. Again, this is pending if kids go back to school or not. But we have talked about that could be a potential solution is using the resources in the community as their electronic resource if they don't have that access in their homes, and working with the schools to provide education for that and as an outlet for those visits that we can and do virtually, and have them be at home, or closer to their home, much easier access to us.
Great, thank you. Andrea, did you want to say something?
Sure. So because we do have that virtual based model, the one thing we're looking at long term, we have our online application form, and we're seeing such an influx in the number of families needing our support. So in my role in evaluation, I'm trying to figure out how can I improve our form continuously, so that way we're getting all of the necessary information for our social workers to jump in and be able to process the case as soon as possible, because we're seeing with such an influx, there might be a little bit of delay in getting that service. So we're continuously looking for ways to improve the user experience of filling out the application form, whether it's a family or a social worker. And then when it gets to us, being able to process the case as quickly as possible and get the families tied to the resources and connected to our financial planner. So it's a little bit different, but it's working for us, and it'll definitely be a long-term solution.
And with the number of cases like increasing, do you think that will continue, or do you think it's going to drop down a bit? Have you sort of are planning for that?
So we are planning for an increase. We continue to see a month-over-month increase in the total number of mission eligible inquiries. So we're looking at ways to better manage the inquiries coming in, looking at additional staffing support, and trying to figure out what our next best move is, because more families need us than ever. We actually implemented documentation to see if families are coming to us who have been impacted or have had a loss of income from COVID. And I would say probably like 95% of our queue right now has been impacted by COVID. So we're seeing a significant increase.
Okay. And I just thought with that increase in demand across all services, how are you all trying to prioritize whether, sort of who gets access or who gets the services, and sort of is it done on where someone's located or what they have or what they don't have, or just thinking about different, prioritizations and helping everyone you can?
We've actually implemented a risk assessment that helps identify the financial needs of our families. So we have a scoring system built out in the back end. So our navigators, or also known as our social workers, they can see the priority level or the risk of financial needs for the family. So we try to prioritize those with the greater risk, also while balancing the time that a family is waiting in the queue. So it's kind of a delicate balance, but we do have that component to flag families who might need emergency assistance right away.
Okay, great. That's good to know. And Michelle, with your project, I know it's a pilot project and you're doing it over 3 years. Are you sort of planning for that technology component, like sort of training individuals and patients along the way? Do you hope that people will, sort of over the years of monitoring the patients, they will get used to the online surveys and using technology?
Yes, along the lines of what Anne was saying, it very much seems like telemedicine is here to stay. And one of the few upsides to COVID may be that it has kind of pushed along telemedicine for everybody. But we at this, over the last few weeks, have kind of built into our surveys a question of an open-ended question of what can we do to improve this experience for you, and with the plan that while this is a pilot project, and after the first year we will definitely be reassessing what we're doing right, what we're doing wrong, and how to improve the experience for patients overall. Definitely planning for this to be more of the norm, and maybe even expanded to, currently we're doing this in really good prognosis patients, expanding this to further populations of patients. as well as just more virtual visits in general. What was the, sorry, I missed the other part.
No, that was, yeah, it's good to know sort of in terms of planning for the future and just sort of that technology side of things. And hopefully, yeah, I think with everyone becoming used to online communications and like you say.
On the medical side, one of the things that we are really trying to be mindful of in how much we ramp up virtual care is, ideally, we can offer, ideally we're able to offer everything virtually, right? But you also want to balance that on the medical side with not missing anything. And so, a good check over the next few months is, as patients will still be seen in person less frequently, and the multidisciplinary team is kind of meeting on a regular basis to also discuss verifying that there is not any oncologic downside or survivorship downside to trying to further virtual care.
Mm-hmm. Yeah, absolutely. Great. Good to know. And any attendees and that have any questions, please feel free to ask the panel. You type them in the chat box or question or answers, or let us know how you're planning. But anyone else on the panel was thinking more about long-term plans, and Len, I'd be curious to know about how you're prioritizing sort of the need that or everyone that you have to serve. I guess I'm sure demand has gone up for you as well. But.
Yeah, a lot of our funding comes from grants, and some of the grants are geographically specific to certain areas. So we typically target the top 10 communities that where we have relationships and seek to expand. But some of our biggest challenges are we'll get a grant for a very tight geographic area, and so we've really got to execute really well with those hospitals to be able to to communicate the value proposition of what we offer, and to get the engagement with the health professionals to help share that with the families at the clinics. So that's one of our biggest challenges. We have never had to say no to a child, so we're pretty fortunate. We've been able to establish the funding. So that's. But I think that over time, I think it's it's going to scale. I mean, I think that the whole idea of communicating and sharing information the way we're doing this right now is going to drive a lot of changes in the way in which we all work. I was just curious, a question to Michelle in terms of the medical profession, and also to Anne. I mean, with increasing telemedicine, I mean, do you anticipate that the stresses on the physical facilities that you have will be lower as you have more and more patients being seen outside of the waiting room? I'm just curious what if you fast forward for both of you, post COVID 3-4 years from now. I mean, is that something you all are preparing to think is going to happen?
Yes, I jokingly. So parking in Ann Arbor is way worse than you would think it is at the medical center for being the middle of the Midwest. Parking will definitely be better, and I think everybody inside and outside this project is kind of moving towards trying to do things virtually that make sense virtually, and obviously continuing in-person care when it's needed. So, for example, I'm a radiation oncologist, or the model that we've kind of put in place for the next year clinically is I meet everybody virtually first, and then part of going through radiation is you have to come in person on a radiation planning session. So most of the physician schedules have changed so that half of our clinics are now virtual and half of it's in person, and you meet somebody virtually and kind of go through information virtually, and then meet them in person at step 1.5 now, where when they're coming in for something that has to be done in person. But yes, I would guess that permanently moving forward, patients are going to demand it, that less in-person unnecessary stuff that takes up time is going to be done more virtually. We kind of related to this pre-COVID for the patients that this project is focused on, we had surveyed our patients and to see if they would participate in virtual care, because a little piece of cancer is, some people really like to come in and they like to have a physical exam and they like to have their scans and they like to know, like, I don't have cancer right now, and they like to hear that in person. About 75% of our patients were totally overburdened by the cost and the time and of coming in person, and this is, at least for some visits, is much more convenient. I was actually surprised to learn that even though we have a pretty high functioning population of patients here, that about 75% of them said they spent a half a day in just a routine follow-up visit, when they accounted for like time for travel and parking and waiting in the waiting room. And I think patients will demand it moving forward.
I agree. I think that there is a move towards better streamlining the processes. You know, people are more accepting of now using their closer by resources, they're closer by labs, and kind of helping facilitate their move through clinic and the hospital stay. I think that you know, before COVID, we've become such a global population. I mean, all these younger kids, that my nieces and nephews travel all over the world all the time now, and that's much more the norm. And I think that people want their resources that they need closer and more available, so they have more flexibility with their time to do what they want and where they want it. So I think that there's definitely a hybrid that's going to happen, and I think the footprint of the hospitals will, instead of taking up city blocks, will be further scattered out. So there is more accessibility to people closer, to be able to do remote things and have healthcare more easily accessible to them.
I was going to add something I just thought of. We usually send out parent surveys as well. So that's something we're going to look at. Last year is just the level of satisfaction. Last fiscal year, we had 100% families respond very satisfied with the services that they were provided. So now that it's all virtual, we're going to, and there's spaces to write comments. So we're going to look at, because we don't want the satisfaction for our types of services to decline, because with the support we have that we give for kids, the ultimate, like the best and most therapeutic environment is the playroom in our office, where they have the toys and the expressive play items and medical play items, and that's just the best, most therapeutic way for a child to really learn and understand and comprehend what's going on and express themselves freely. So we're going to look at we're going to compare those surveys and see if there's a dip or if virtual support, if it's still consistently effective quality-wise with the families. And if so, that's probably something, because now we can see more families that may have not been able to drive and make it to one of our offices, especially before COVID, with rush hour in Austin, getting to an office afterward, it just became a struggle. And then sometimes on Saturdays, kids have soccer practice or games. And so there's always a limitation and a barrier with getting to our office. So we might move into a hybrid moving forward for patients who maybe can't get to one of our offices. But I think we're definitely going to look at the surveys from the families just to see, because we want the quality to kind of stay the same for this type of support we're giving.
Yeah, it's interesting. Our patient satisfaction and engagement survey scores from the past 2 months have been higher than they've been in a long time. And I think it's because there's that added convenience for patients and families to be able to have access to their healthcare provider on their time frame, and without having to, you know, find sitters and get these kids there. And I think that as, you know, healthcare providers, we've become, as we are in the office, more accustomed to these interruptions during our visits and life things that happen. I don't know if any of you have noticed, but as I've been on this call, I've had a teenager come in who insisted he needed something in the room that I'm in, and a dog joined me. And I think that those type of things are just things we're becoming more accustomed to. And I think that convenience has been really important to patients and families.
I think one of the other elements too is the social equity piece of this, because there's an awful lot of families that need public transportation to be able to move from one place to another. And so I think, you know, with these breakthrough events that are occurring in just in such a rapid succession, I think it's, you know, forever shift the balance of better care and more responsive care. And no, I think it's just a wonderful thing, and seeing these two things tie together, because we've always been focusing on the social element of it, you know, because kids are lonely. I mean, when you're out of school, you know, during going through oncology treatment, you're immunosuppressed. I mean, you're high risk, and you know, you're depressed. I mean, that's what happened to my son when he went through cancer, and you know, so I think now, I mean, everyone has an understanding of that and empathy for that. But when you link the telemedicine to the social connection, and then now you connect it to, you know, the medical piece, and then you realize that you're now able to provide cast a much wider net. It's just, I think it's going to be one of the real silver linings of what we're going through right now.
Right.
We did our first group session not too long ago. We were just doing individual sessions for a while, but we did a group session. And we had kids both from Austin and San Antonio in the group. So that was kind of cool that we wouldn't have been able to do otherwise if we were just in the office. So they were able to connect with people outside Austin with our San Antonio location too.
Wonderful. I think it's great, that balance of like surveying and getting, and sort of the patients you serve, getting their feedback to see how things are going, and as well as like sort of putting in place your best practices for the future. But I think technology is only as good as, you know, your internet connection or the software you use, or just that accessibility component as well. So I think, yeah, maybe I take it for granted for sure, like, but the moment the Wi-Fi goes down, and then everything's a bit more problematic. But does anyone have any final comments? We just got a couple of minutes left. Anyone want to mention anything before we all head off on the day? No. I can wrap things up then, but I just want to take a moment to thank you all and all of the attendees. It's been a very, I think, yeah, productive conversation, and I'm very grateful for you all to share your challenges and experiences and some solutions of what you're doing now. There were a few links and suggestions and comments in the chat which we can share out with everyone after the call. And then, oh, Suzanne's back. I don't know whether she wants to say anything, but I just want to let you all know that, yeah, we'll share the recording tomorrow, and there will be a survey that goes around, because we want your feedback, want your comments. We are doing these webinars each month for the community. So please let us know your thoughts on how we can improve in different topics, and whether anyone else wants to get involved with the panel discussions. That was my wrap up. Suzanne, did you want to say anything? Or?
I just wanted to say thanks again. You guys are great. It's I really enjoy hearing what you're doing, how everybody's adapting, and I'm anxious to hear from everybody who was listening in, you know, what some of those ideas, what those takeaways are going to be, and how you're going to implement them in the programs and the projects that you're working on. So thanks again, and look out for some more great stuff. We've got a couple of icons that are coming up. We've got Icon EQ, Equity in Cancer Care, that's coming up on July the 9th. Really excited about that one. And then we've got Icon Midwest that is going to happen on August the 7th. We're actually, Brittany and I are going to brave the skies, and we're going to go to the Des Moines Cedar Rapids area. That Icon is going to be focused on pediatric cancer, but specifically for those who live in the Midwest. So if you have a nonprofit in the Midwest, or if you are providing services to communities that encompass the Midwest, then we invite you to that. So we're really looking forward to that one. So be sure to jump up on our Icon page, and you'll get info on it as well. But yeah, lots of great things coming. So everybody have an amazing rest of your week, and we can't wait to see you next time. Thanks so much.
Thank you all. Take care. Bye.